Hello, my name is Miriam. I'm one of the speech and language therapists in the Southwest Cleft service. This video is for all school staff in schools where one or more pupils born with a cleft palate attend. Here is an overview of what I will cover in this presentation. Children can have one of various cleft types, as shown in these images. The cleft, which literally means gap, can affect the lip, the gums, the hard palate, which is bone, or the soft palate, which is muscle, and any combination of these. The cleft can be on one side only or on both sides. Children who are born with a cleft of the lip only do not tend to have speech difficulties. Children born with a cleft of the soft palate, so the muscly bit, are at higher risk of developing speech difficulties. Children who have a cleft on both sides, so a bilateral cleft palate, or children who are born with very wide clefts, tend to have more significant speech difficulties. There is no single cause of cleft. Research tells us it's often caused by a combination of different genetic and environmental factors, but because of the huge number of factors involved, it can be very difficult to narrow these down. These are the main jobs that the soft palate has to do. Stop food and drink going into the nose, ventilate the eustachian tube in the ear, which is necessary for hearing, close off the nose from the mouth for making most speech sounds, and to control resonance, so the tone of speech. The presence of a cleft in itself does not tend to affect any other aspects of a child's development, such as language development or learning. However, clefts are often associated with a range of syndromes, which may then come with other language or learning needs. Children born with a cleft do often have hearing difficulties. There is a huge team around a child born with a cleft. When the child is a baby, the cleft nurse specialists contact the family within 24 hours of the diagnosis or the child being born. The nurses are available to support in the early years, particularly around feeding. The surgical team are often involved throughout childhood. In the first year or so, the lip and the palate are repaired. Around 50% of children with a repaired cleft continue to have speech difficulties, and 20 to 30% of children will need more surgery, specifically to support their speech. Children with a cleft involving the alveolus or gums will also need an alveolar bone graft, and we have a video explaining what this is on our website if you're interested. When young people are around 18 years old, they may also have jaw surgery. Before the children start school, the speech and language therapy pathway includes 2 advice sessions on how to support the child's speech development through babble, a speech assessment at age 2 and 3, and if required, 4 group therapy sessions after this. After the child's 3rd birthday, they will then receive one-to-one therapy if required, and working with nurseries and later on schools is essential to ensure the children receive appropriate and frequent intervention. Audiology regularly assess children's hearing because we know that children born with a cleft are at higher risk of hearing difficulties because the muscle of the palate is also linked to the ears or the eustachian tube. Cleft teams also have clinical psychologists who provide support to parents and children for any issues around their cleft. Dentists and orthodontists are involved because a cleft affects teeth growth because of the difference in the structure of the mouth, and also children born with a cleft are more prone to dental caries. It is important to bear in mind that the children attending your school may need to attend appointments to see these health professionals within their school day. If you have already met a child born with a cleft who has speech difficulties, these typical cleft speech characteristics may sound familiar to you. A child's overall tone may be nasal, whereby there is too much air resonating in the nose. The child may also have some air escaping through their nose. Sometimes you can hear this, but other times you can't. Children born with a cleft may struggle saying some of their sounds because they have learned incorrect habits that they developed before they had their palate surgery or before the palate was able to work effectively. They may therefore replace some sounds with others, for example, front sounds t with back sounds k, or produce some sounds differently to how a typical speaker would. For example, an S through their nose, or with the air coming down the sides of their mouth rather than down the middle. The aim of speech therapy is to help the child produce all speech sounds to the best of their ability. This involves helping them realise, in a playful manner, that they have stored the sound incorrectly and must learn a new way of saying it. We have made a video describing the steps we tend to take in therapy, which you can find on our website. Learning how to use a new sound on its own, and then with a vowel, in words, sentences, and everyday life, can be really challenging for children. Imagine someone telling you to suddenly replace all k sounds with t sounds in your talking. When children can't do it, they are not being lazy, they are trying really hard to change a habit they have developed ever since they started speaking. Here is a list of all the people who may be involved in a child's speech therapy journey. The child needs to be engaged and motivated, and the parents need to be practicing the sounds at home too. Children spend most of their time at home with their families or at school, and therefore practice in both these settings is essential. I am one of the Cleft team specialist speech and language therapists, and my job is to only see children born with a cleft or other palate-related speech difficulties. There may also be a school therapist who your school buys in, or a local community therapist for your school. The aim of the specialist Cleft team is to support children to achieve sounds in isolation, using all the tricks we know work well with this client group. However, once children can say the sound on its own and blend it with a vowel, it is appropriate for the children to be seen by the school or community speech and language therapy teams. The community team may also need to be involved if the child has any other language or communication needs, or speech difficulties that are not related to the child's cleft, such as a phonological speech sound disorder or a speech delay. You may find yourself in situations where you are chatting to a child and you do not understand what they are saying. Here are some tips for how best to manage this. So acknowledge it and be honest. Say, "I'm sorry, I didn't understand that word." It can also be useful to blame yourself. For example, "I didn't have my listening ears on. Can you say that again?" But don't do this too often, as they will likely cotton on to your strategy or eventually wonder why you can't just turn your listening ears on. Encourage other means. For example, "Can you point to it, or draw it, or write it down, or take me to it?" Ask questions about what they are telling you. For example, "Are you talking about something that's in this room, or are you talking about your schoolwork?" Repeat the words you have understood correctly. For example, "You had a birthday party with a bouncy castle. What else did you say you did? You had a..." This means that the child knows that you have at least understood some of what they are saying. Listen to what the child says, not how they say it, and respond accordingly. For example, if you have understood them, don't comment on the fact that they didn't say it clearly. Don't practice mistakes. So avoid asking the child to repeat words that they find difficult, unless they are in the last stage of therapy when this is encouraged, but please only do this if you have specifically been asked to do this. Rather than asking them to repeat a difficult word, model it back to them clearly. Encourage the child to talk and play with others to increase their confidence. Children may start to feel isolated if they aren't encouraged to keep trying. Where possible, find a quiet place to talk to the child so you can hear each other and you can take your time to respond to the child, for example, using some of the strategies that I have just described. Our team have made a number of videos to explain various different therapy approaches, such as babbling, input modelling, and articulation therapy. We have also made a video for teaching assistants and learning support assistants who will be working on the speech of children born with a cleft. That video goes into a lot more detail about the therapy activities we recommend are carried out with children at school. If you are a TA or a learning support assistant, please watch that video, which can be found on our website. You can just scan the QR code with your camera phone or visit the website via the link below. And that brings us to the end of this PowerPoint. I hope it's been useful. Thank you for listening. Please don't hesitate to give us a call if you have any questions about this PowerPoint or about the children that you're working with. Thank you.